Thank you, Rio. I appreciate you being here today. This is a subject that means a lot to me over the last couple of years, and it's something that I've been looking more into of late, and we'll talk about why. But when I think of this topic, I always think of that airplane analogy. The oxygen mask that drops down is for the person to use prior to helping anyone else. Well, why shouldn't we practice this in our everyday lives? We all have stress. So let's learn a bit about it and how we can find coping mechanisms to lower our stress levels, even in times that we don't feel like we can. We have to take care of ourselves before we can take care of others. And as educators, we need to train our students to do the same. We were lucky in Michigan a few months ago. We had Dr. Kirkpatrick, a clinical psychologist, do a webinar for us, for all of our clinical staff on stress management. And she is the expert. I am not. But this topic is important, and that's why we're still talking about it today. I hope that this presentation will give you resources to find more exclusive information for EMS and first responders specifically. As a disclosure, I am a paramedic and an EMS licensed instructor coordinator with a master's degree in education. So I'm certainly not qualified as a counselor or a mental health professional. But we'll talk today on recognition and techniques to work through stress and anxiety. And most importantly, if you are seeking help, be sure to seek the right help. And we'll, of course, highlight all of those. So our objectives today are to ensure that EMS instructors have a comprehensive understanding of various mental health disorders, their symptoms, and potential triggers, to implement stress management techniques for your students, and to foster collaboration between EMS professionals and mental health providers to ensure students learn to care better for themselves before getting out in the field and caring for others. This word right here, stigma. Why are we focusing so much attention on mental health in recent years when we never really talked much about it before? Well, we're going to discuss some cases today that we'll recognize as EMS professionals who have gone down the wrong path and allowed stress to turn into burnout, to possibly even turn into post-traumatic stress disorder. As a side note, we are overutilizing the PTSD words. So let's work on that. Let's work on promoting our mental health and getting rid of that stigma word. Let's prevent burnout and PTSD. And most importantly, let's just talk about it. So let's talk about this article that I read. There is so much research and information in this article, but it's titled First Responders and Mental Health, When the Heroes Need Rescuing. And it was published in the Psychiatric Times in September of 2022. In that, some of the highlights: first line contact in any emergency situation. We're the most chronically exposed to stress and traumatic seen in the line of duty on a daily basis. 30% of first responders develop behavioral health conditions compared to 20% in the general population. 69% of EMS providers report not having enough recovery time between traumatic incidents. And 28% lifetime prevalence rate of feeling as though life was not worth living. There really is a lot of research and information in this article. It is well worth your read. Mass shootings, COVID response, workforce depletion. We've really been going through a lot as a profession. And if you would sit down and add up all of your highly stressful calls that you have personally responded to over your career, you would probably be amazed at the number and how you could have come out on the other end doing pretty well. The calls, though, do not have to be related to those subjects that we've already mentioned. A highly emotional call, maybe a distraught family member tugging on your arm that really triggered an emotional response, maybe a pediatric patient that you just could not help fast enough, maybe responding to a call in which you have a family member or someone you are close to going through a similar situation, or that they would be the person you have to care for. It all adds up, though. If our heart stops beating, we start chest compressions and apply an AED to get it going again. If we have a bleed, we do something to stop that bleed. If we have a deformity, we splint it. But what do we do when stress builds up? Until recently, really nothing. We've all had or heard the words, suck it up or move on. I'm ashamed to say that I've said that in my previous positions. But it really is time that we care for our mental health as passionately as we care for our medical health. What is the difference between stress and anxiety? The American Psychological Association defines stress as a normal reaction to everyday pressures, but they can become unhealthy when it upsets your day-to-day functioning. Stress involves changes that affect nearly every system in the body. It influences how people feel and behave. And by causing those mind-body changes, stress contributes directly to psychological and physiological disorder and disease and affects your mental and physical health, which also reduces your quality of life. Anxiety is an emotion characterized by feelings of tension, worried thought, physical changes. People with anxiety disorders usually have recurring intrusive thoughts or concerns. They may avoid certain situations out of worry. They may also have physical symptoms such as sweating, trembling, dizziness, or a rapid heartbeat. Anxiety is not the same as fear, but they're often used interchangeably. Anxiety is considered a future-oriented, long-acting response broadly focused on a diffuse threat, whereas fear is an appropriate, present-oriented, and short-lived response to a clearly identifiable and specific threat. There's one thing that sticks out in my mind that causes me a lot of anxiety is in Michigan, to get from the lower peninsula to the upper peninsula, we have a 5-mile long bridge. There's very little guardrails that would catch you if you were to drive off the bridge or toward the side too much. And we often have it closed due to high wind warnings. That gives me anxiety even thinking about driving over that bridge. That anxiety continues until I get over that bridge. But it really causes me a lot of stress and anxiety at the time. It causes me anxiety prior to. So just simple things to think of the differences between stress and anxiety. This is a flyer I got from the National Institutes of Mental Health, that stress is generally a response to an external cause, maybe taking a big test or arguing with someone. It goes away generally once the situation is resolved, and it can be positive or negative, and we'll talk more about that in a minute. Anxiety is generally internal, meaning it's your reaction to a stress, which I can relate to. But both stress and anxiety can affect your mind and body. Things like excessive worry, uneasiness, tension, headaches or body pain, high blood pressure, loss of sleep. Some of the ways to cope that are recommended on the NIMH is to keep a journal, write things down. We'll talk more about that in a minute. Download an app with relaxation exercises. Exercise and eat healthy. Get regular sleep. Avoid excess caffeine. Identify and challenge your negative thoughts. Or reach out to your friends or family. Find help if you're really struggling to cope, or the symptoms of your stress or anxiety begin to interfere with your everyday life. It may be time to talk to a professional. You will have to decide on that. But to find more information about getting help, just go to that NIMH www.nih.gov to find help. Maybe you would want to write down what your anxieties are, and then in a separate column, what stresses you out. This may be helpful to understand the differences and then help you to work on a plan to eliminate them. Maybe you could have your students do that in class when you're talking about stress management. Can we really eliminate stress? Well, not really. It is an external force, but maybe we can learn how to better deal with stressful situations. And we've all heard that saying, something that happens is really about 10% of that issue, but it's 90% how you react to it. So if you keep that in mind, things should go a little better. But a little more about stress. The eustress, the good stress, and the distress, the bad stress. Eustress is a positive response to stimuli. Think of a wedding maybe coming up, or buying a home, or having maybe an unexpected baby. Where distress would be that negative response to external or environmental stimuli. The sources of anxiety and stress-related disorders. Think maybe divorce, maybe having the in-laws come and stay with you for a week. Maybe just everyday pressures that we deal with. Again, we respond to a lot of various calls, some of which are pretty traumatic, and we don't often get times in between those calls to just decompress. Maybe it's sitting in a truck or an ambulance with someone you have a personality conflict with. Or maybe it's late calls every day this week, which in turn causes you to stress about picking up to your kids or getting dinner started, things like that. It all adds up, though. Hans Seeley, who's an Austrian-born professor at the University of Montreal, coined the term stress in medical usage in 1950. Prior to 1950, stress was not even considered a medical term at all. But he identified 3 stages in the stress response: alarm reaction, resistance, and exhaustion. And this is called the general adaptation syndrome. And that refers to the attempt of your body and your mind to deal with stressful events. The alarm reaction would be the fight or flight, your argument maybe with your coworker, or maybe you're performing a patient care procedure that you haven't practiced since you were in school, or you're practicing it now for the first time on a real patient instead of a simulated mannequin. Resistance is the phase where EMS professionals are often in and stay in. If the alarm reaction lasts long enough, the person's reaction is going to change. You just get used to that stressor. And then exhaustion, finally, then it's the negative stress over time. Your reservoir, your adaptive resources, they're used up. You're just done. And those are the 3 phases of the general adaptation syndrome. So let's talk specifically about things like burnout. It's a result of cumulative stress. It's characterized by physical and emotional exhaustion, negative attitudes, develops when someone is exposed to chronic stress that cannot be managed with the usual coping mechanisms. So your reservoir is done, just done. Some of the early physical signs that a person would feel when they're burned out is heart palpitations, maybe difficult or rapid breathing, dry mouth, chest tightness and pain, anorexia. Also could have nausea, vomiting, diarrhea, abdominal cramps, flushing or red-faced, diaphoresis, dysmenorrhea or abnormal or difficult periods, decreased sexual drive, aching muscles and joints. These are all warning signs of burnout. What do we see when we work with someone who is experiencing burnout? Well, we often see the bad attitude. They're difficult to be around. They just complain all the time, right? While you try to bring their attitude in a more positive direction, oftentimes that burnout or that bad attitude will bring that positive person down. So it's really hard to deal with someone in that burnout phase. We could get to them and get them to work through their stressors. Hopefully, we can prevent some burnout, and we'll talk more about that in a bit. What about this post-traumatic stress disorder? It's a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event, a series of events, or a set of circumstances. An individual may experience this as emotionally or physically harmful or life-threatening, and it may affect their mental, physical, social, and/or spiritual well-being. Examples would include natural disasters, serious accidents, terrorist attacks, war and combat, rape or sexual assault, historical trauma, intimate partner violence, and bullying. PTSD has been known as many other things. After World War I, they called it shell shock. And after World War II, they called it combat fatigue. But PTSD does not just happen to combat veterans, and we know that. It can occur in all people of any ethnicity, nationality, or culture, and at any age. PTSD affects about 3.5% of the U.S. adults every year. The lifetime prevalence of PTSD in adolescents ages 13 to 18 is 8%, which that surprised me that it is that high for our adolescents. An estimated 1 in 11 people will be diagnosed with PTSD in their lifetime, and women are twice as likely as men to have PTSD. That surprised me as well. 3 ethnic groups, U.S. Latinos, African Americans, and Native Americans/Alaska Natives, are disproportionately affected and have higher rates of PTSD than non-Latino whites. People with PTSD have intense, disturbing thoughts and feelings related to their experience that last long after the traumatic event has ended. They may relive the event through flashbacks or nightmares. They may feel sadness, fear, or anger, and they may feel detached or estranged from other people. People with PTSD may avoid situations or people that remind them of that traumatic event, and they may have strong negative reactions to something as ordinary as a loud noise or an accidental touch. Symptoms of PTSD fall into the 4 categories specified here on that slide. Intrusion would be intrusive thoughts, such as repeated involuntary memories, the distressing dreams or flashbacks of the traumatic event. Flashbacks may be so vivid that people feel they are reliving that traumatic experience or seeing it before their eyes. Avoidance would be avoiding reminders of the traumatic event, and that may include avoiding people, places, activities, objects, and situations that may trigger distressing memories. People may try to avoid remembering or thinking about the traumatic event. They may resist talking about what happened or how they feel about it. Alterations in cognition and mood, the inability to remember important aspects of the traumatic event. Surprisingly to me, 10 years after 9/11, they re-interviewed people who lived in New York City on 9/11. They had interviewed them that day and had them write down specific things, where they were at, what they were doing, those kind of things. 10 years later, their memory of that, where we all know what we were doing on 9/11, it was strange to find out that they didn't have that detail that they had on the day. And it really is pretty interesting to read about. So keep that in mind. Do some research on that. That alteration in the cognition and mood, the negative thoughts and feelings leading to ongoing and distorted beliefs about oneself or others, like I am bad or nobody can be trusted. distorted thoughts about the cause or consequences of the event, leading to wrongly blaming yourself or others, maybe ongoing fear, horror, anger, guilt, or shame. Much less interest in activities that they previously enjoyed, feeling detached or estranged from others, or being unable to experience positive emotions where they're just in that negative area and they just can't get out, a void of happiness or satisfaction. And then alterations in arousal and reactivity. The arousal and reactive symptoms may include being irritable or having angry outbursts, behaving recklessly or in a self-destructive way, being overly watchful of one's surroundings in a suspecting way, being easily startled or having problems concentrating or sleeping. Many people who are exposed to a traumatic event experience symptoms similar to those described above in the days following the event. But for a person to be diagnosed with PTSD, the symptoms must last for more than a month, and they must cause significant distress or problems in the individual's daily functioning. Many individuals develop symptoms within 3 months of the trauma, but symptoms may appear later and often persist for months and sometimes even years. PTSD often occurs with other related conditions, such as depression, substance use, memory problems, and other physical and mental health problems. So what has caused you to have burnout or maybe PTSD? Let's really think about this for a minute. Maybe a bad pediatric call. Maybe you responded to a friend or family member who needed your help. Child or elder sexual or physical abuse, multiple trauma calls, maybe just dealing with personal issues while you had to work in a stressful environment. Has a friend or a coworker ever told you that you're seeming a bit stressed lately? Or asked you why you seem to be complaining about everything? Have you ever felt like everything is everyone else's fault? These are signs of that cumulative stress, maybe burnout. We don't diagnose PTSD, and quite frankly, we overuse that term, as I said earlier. There are many people out there that are diagnosed with PTSD, and if we use that term lightly, are we taking away from those who truly suffer from it? So let's talk about now, what can we do? And when I was researching this particular presentation, every single peer-reviewed research available shows these 3 items help deal with and prevent stress and anxiety. Do you practice these or all 3 of these? Healthy eating, healthy exercise, healthy sleep. Maybe you don't practice any of them. As EMS professionals, we kind of have a bit of a history of having some unhealthy habits. Not everyone, of course. There are many resources available to help us learn the importance of these 3 things in our daily lives and how to really work on improving these 3 areas. We talked earlier about journaling. If you've made a column of what gives you stress and a column of what gives you anxiety, maybe on the next page, start writing things down. Like maybe for a week, maybe starting tomorrow, Tuesday, you will write down everything you eat and the times that you ate. Maybe you also write down the times that you did a little bit of exercise. Maybe you walked 200 steps. That's an accomplishment. Write that down. Keep that in. That is your journal. And then you can go back a week later and see what your habits are. How well did you sleep? What did you do to help you go to sleep? There are a lot of resources out there that help us learn the importance of these. So when you journal them, then find out areas that you can do to improve on those. You know, the chocolate cake maybe that you ate last Thursday was awesome, but it does nothing for you today. So keep that in mind when you're thinking about healthy eating. What is it going to do for me tomorrow? Nothing. Although it was amazing, it's probably not going to help you. And maybe change that chocolate cake into some carrots and celery or something like that. Could you incorporate maybe a few more vegetables or fruits into your daily routine? And what about that exercise? Oftentimes if people are sitting in an ambulance or they're at a station for a lot of the day, and if you journal how many steps you take each day and at what times, maybe you could add a few into your daily routine. A little change is better than no change. And that healthy sleep part, it's so hard in EMS to get healthy sleep. Document your bedtimes and awake times for a week and really review it. Do you go to sleep with TV on or a radio on? Have you tried any of the calming sounds? There's a lot of apps with those ocean sounds, things like that calm people. Maybe you need that to help you go to sleep. But really look at your journal after a week and try to figure out why you're having a difficult time sleeping. I know that you're thinking, well, we work abnormal shifts. If we're educators, we're working all the time. It's not just teaching today, it's preparing for tomorrow. And sometimes you don't have time as a luxury, that's for sure. So our schedules don't allow us to sleep in normal sleep oftentimes, and I get it completely. But let's look for ways to improve each of these items. And I gotta tell you, all the research I did, these three things are in every one of them that says to eliminate or reduce stress, anxiety in your life is to eat healthy, exercise, and have healthy sleep. So I could not find an excuse not to have those in here. One of the things that is maybe new to you, people are practicing this all over, called mindfulness. It's a research-proven way to reduce stress. It really makes you train your attention. It's an effective way to calm concentration and have positive emotion and attention and acceptance. People have been meditating for thousands of years, often as part of a spiritual practice. But in more recent years, mindfulness has become a popular way to help manage their stress and improve their overall well-being. There's a wealth of research that shows that it's effective. Psychologists have found that mindfulness meditation changes our brain and biology in positive ways, improving our mental and physical health. Mindfulness is one of the most popular meditation techniques, and it takes two main parts: attention and acceptance. The attention piece is about tuning into your experiences to focus on what's happening in the present moment. It typically involves directing your awareness to your breath, to your thoughts, and the physical sensations in your body and the feelings that you're experiencing. And then the acceptance piece involves observing those feelings and sensations without judgment. Instead of responding or reacting to those thoughts or feelings, you aim to note them and let them go. Mindfulness classes and mindfulness-based therapies provide the tools to put those concepts into practice. There are many YouTube videos on mindfulness. Feel free to check those out. Such programs might include breathing exercises, yoga, and guided lessons to help you become aware of your body sensations, thoughts, and feelings. And if you've never watched any YouTube videos or attended a goat yoga, goat, G-O-A-T, yoga class, really look at those videos. It looks like a blast, and I need to try it sometime. Researchers reviewed more than 200 studies of mindfulness among healthy people and found that mindfulness-based therapy was especially effective for reducing stress, anxiety, and depression. Can also help treat people with specific symptoms that include depression, pain, smoking, and addiction. Shannon Brule, who's one of our in Michigan paramedic program directors, for Henry Ford College in Detroit, she began an amazing project with her EMT and paramedic students a few years ago regarding this type of meditation. I'm not going to steal her thunder, but she has done amazing things, and she recorded some of her students who have helped us understand a little more about what they do. But they start every day with some mindfulness exercises. They turn the lights off. Everyone just breathes, concentrates on what they need to concentrate on, and lets go what is worrying them. And they all say, every single person that she interviewed for us, that they not only practice this in the classroom with her, they practice it in their life, when they're doing their clinicals and field internships, and that they don't ever want to live not practicing this. So, like I said, I'm not going to steal all of her thunder, but it's really pretty interesting to see how well they not only have practiced it in class, but how they're going to continue that through their life. But there is a lot of research on this. Try to practice it maybe a little bit today. I was at a conference here a couple weeks ago on suicide prevention, and one of the gentlemen that was speaking said, okay, everybody just close your eyes and take a breath, a deep breath. Just take a breath and just picture that you're looking at your chest where your heart is, and that's all you need to think about. So just everybody take a breath, concentrate on your heart, and just do that for a couple minutes. Continue to breathe, of course, and see if you feel a little calmer. That's just a simple thing that you could do, even in a stressful situation, that can help you get through that and maybe manage that. Some of the other things that employers can do to help, and I appropriately titled this slide, well, allow adequate rest for emergency workers, limit exposure to the incident, change assignments, provide post-event diffusing or debriefing. So some of these you can't really do. However, maybe there are options that changing assignment or the limiting exposure to the incident, possibly after that incident, whatever they've responded to, maybe they can have a timeout to just gather their thoughts, figure out how to move on from it before they get a next call that could be just as stressful. Changing assignments. Maybe you have a station that has a slower call volume. Maybe they could do that to help. Does your agency or do your agencies provide post-event diffusing and debriefing? Do your employers have an employee assistance program where they have maybe some help net or some psychological services that can just help talk things through to make sure that you're dealing with the stress okay? But here a couple years ago, NASEMSO conducted research on fatigue in EMS from 2017 to 2022. And these are the recommendations after much research, including stress of the provider, accidents. The results are amazing, and feel free to go to ems.gov to look at the research. This is not only research related, but also has education for the EMS professional on sleep patterns, fatigue reducing information, and this has been published, so take a read. So what are the guidelines? Recommend using fatigue or sleepiness survey instruments to measure and monitor the fatigue in your personnel. To recommend that EMS personnel work shifts shorter than 24 hours in duration. Recommend that they have access to caffeine as a fatigue countermeasure. So now you have permission to drink that coffee or soda. Recommend that EMS personnel have the opportunity to nap while on duty to mitigate fatigue. That's pretty exciting. I was very excited to read that. And then recommend that EMS personnel receive education and training to mitigate fatigue and fatigue-related risks. Fatigue has a lot to do with stress, and it's important that we understand that. Critical incident stress management is intended to occur after exposure to a major incident. It does involve peer support. It helps us to understand the reactions of the incident. And there's really no clear evidence that it has a clear benefit in reducing PTSD. But most people, when you talk to them after a debriefing or diffusing, will say that it did help them. There are many programs available to help manage stress. The Code Green campaign is a first responder-oriented mental health advocacy and education organization with peer support, crisis referral, data collection. And then what about, again, those employer-provided services like HelpNet? These are all available and good resources to learn how to deal with stressful situations. So please, really, when you're talking about stress management to your students, go over this kind of stuff with them, because it's important that they know they're going to see some bad things out there and you can't unsee those. But what can you do to help prevent that severe stress, the burnout, and then, of course, PTSD. This is another thing you may have heard about. It's EMDR, eye movement desensitization and reprocessing therapy. It treats mental health conditions that happen because of memories from traumatic events in the past. Adolescents, teenagers, and adults can benefit from this, but it's important that you find the right mental health professional that practices this method. And if you talk to people who have gone through some EMDR exercises, they may have had to have searched for a mental health expert that specializes in that. So why is it used? Often it doesn't require talking in detail about a stressing incident. EMDR instead focuses on changing the emotions, thoughts, or behaviors that result from that trauma. It allows your brain to resume a natural healing process. While many people use the words mind and brain, referring to the same thing, they're actually different. Your brain is an organ of your body, and your mind is the collection of your thoughts, memories, beliefs, and experiences that make you who you are. The way your mind works relies on the structure of your brain. That structure involves networks of communicating brain cells across many different areas. And that's especially the case with sections that involve your memories and senses. That networking makes it faster and easier for those areas to work together. So that's why your senses, sight, sound, smells, taste, feels, can bring back strong memories. So I'm not going to carry on more about this EMDR. I do know that it has helped some EMS professionals with their stress management. But again, you have to have the right professional helping, for sure. Oh, what about alcohol? Well, we know that maybe alcohol might lead to positive feelings and relaxation. That's short term. Think of those days when you went home after work and just drank a beer or a glass of wine or whiskey or whatever and said, oh, I need a drink. Maybe it took the stress away and allowed you to react. But the truth is, tomorrow's going to be stressful too. Stress in our field is ongoing, leads to long-term heavy drinking, and begins to work against you, as we all know and we've all seen. Medical, psychological problems, alcohol dependence, bad things happen when we have stressors every day and we use something to help us react to that. Help us calm down, and I'm using air quotes when I say that. And we might as well add drugs into this conversation as well. It's the same deal, though. While that drink may have helped you get over today's stress, if you have a drink tomorrow after another stressful day, well, Thursday is going to be a stressful day, and Friday is also. You just want to try to avoid those kind of things. There's a guide. The National Association of EMTs has a guide to building an effective EMS wellness and resilience program. Take a look at it. You can download the guide right from naemt.org. Something else that my partner in crime here at work, Amanda, has given me some good ideas is to maybe incorporate physical well-being techniques like Tai Chi or yoga. You might feel goofy doing this, but it's a good stress release. And maybe you could barter with some of these places that could give you a deal on if you bring 10 people with you, will you get a deal on the price of taking these classes? Something like that. We know that we have to have a CPR card. Maybe you could trade teaching CPR class for them to offering classes for you and your coworkers. So learn to barter with people about that. Maybe you can get a discount from chiropractors or massage therapists or acupuncturists. Not all of these work for everyone, but you don't know unless you try, I suppose. So it's the same for the discount. It never hurts to ask if you can get a discount from them. And then there's this book called Atomic Habits. It's not easy to suddenly make changes and fully incorporate changes into your everyday practice. But this book has you make small changes that you incorporate each day that over time becomes a habit. This could be something as simple as making your bed while the coffee is brewing. It's through small, consistent behaviors and changes that we make something turn into a habit. And this is also an audiobook. So you're not a big reader, you've got this. Audiobook is an option. Let's talk about the difficult subject of suicide among first responders. There is a call to action for this. This legislation directs the Centers for Disease Control and Prevention to create, I'm sorry, I'm going to sneeze. I'm so sorry. The legislation directed the Centers for Disease Control and Prevention to create a public safety officer suicide reporting system to increase knowledge of these events. So something that they found in 2019 in the US, there were 47,500 suicides in our country and 1.4 million attempts. Police and firefighters are more likely to die by suicide than in the line of duty. EMS professionals are 1.39 times more likely to die by suicide than the general public. All these numbers are thought to be underreported. In 2020, the U.S. House and Senate approved funding for the HERO Act that you might have heard of, the Helping Emergency Responders Overcome Act. This module will build on elements collected as part of the national current infrastructure from the required source documents like death certificates, the coroner or medical examiner reports, law enforcement reports, and then will include information specific to the first responder community. These data will provide opportunities to better understand suicide fatalities and the circumstances around those fatalities among all of our first responders. The challenge is the limited culturally competent mental health resources for first responders' mental health needs. Often, first responders are sent to general mental health practitioners who may not understand the unique demands faced by first responders or the cultures in which they operate. While they may meet the needs of many clients, general practitioners may not understand what first responders experience on the job or be able to relate them in a culturally competent manner. For many first responders, the transition from being a provider to client or patient is not an easy one. When a first responder finally seeks treatment, it can be devastating to encounter an ill-prepared provider and may result in reluctance to seek further help. And I think we can all understand that. I had a call one time that was a very stressful call. We had a child who was ejected from a vehicle. The driver was dead on scene. The child should have been really an open skull fracture with some gray matter showing, but she still had pulses. She was not breathing. We transported her and got her to the hospital. And I really got chewed out by the trauma surgeon who met us in the ER, because he said her injuries are obviously consistent with death and not life, and I should not have transported her. She still, even at the time he's yelling at me over this, still had radial pulses. So they don't understand. The next day, one of the nurses came up to me and said, I never thought before how much you guys see in the field that we don't see here. Like, I would have never seen that. And I said, I would have never transported her had she not had a pulse. But that was an opportunity for the emergency department staff and the trauma surgeon to understand that what we see in the field is often different than what they see in the emergency department. And those are some stressors that can come from that. But I will say that the number, if you or anyone you know are having any thoughts of suicide, the number for resources and suicide prevention is 988. And we are fortunate enough that this number, 3-digit number, finally is in effect and is much easier to remember. This article about the suicides in EMS is really not a good read, but the more we know, the better we can help prevent these from happening. So when I say not a good read, I mean because of the subject matter, not that it wasn't very interesting, but 63 of 1,205 total deaths, while non-EMTs was 2.2% compared to that 5.2%. So were you the kind of person who would have responded to in the past who have attempted suicide? What kind of people do you have in your mind that are those who have attempted suicide? Remember that those who have suicidal ideations, they have to have both the means to follow through and the thoughts to actually do it in order for suicide to be successful. And that's what this article kind of goes over. We have to take care of ourselves before we can help others. So again, if you or someone you know has considered suicide, please call 988. The resources that they have there are tremendous, and every single person is worthy of living, and that's what we have to remember. Our world needs every single person that we have out there. So if you or someone you know, just let them know that you are available to get them resources. Call 988. And it's very easy to have stressors pile up and suddenly you feel as though there's no way out, but tomorrow's always a new day and we can all help each other. And more specific EMS research regarding suicide is coming, and I'm excited to read about that, and I hope that it will help. I know around our area, we have had very, very recent suicides among some of our EMS professionals, and it's very distressing. One person who had gone out and tried to seek help and just didn't seek it out to the right person, and devastating for sure. I'm sure that many of you on this call have watched the video of those 2 medics in Illinois that are now charged with first-degree murder. In the past, when we've made an error in our clinical judgment in the field, maybe people have been sued for negligence. It's now becoming criminal. And if you watch that video, it's about 32 minutes maybe, of them treating this gentleman. They were just, especially her, she was just so mean to this man. And I just don't understand it. Was she burned out? Maybe. Still, is that an excuse to treat people poorly when you're working? And the answer to that is not at all. And then another recent one, Tyree Nichols. If you watch the video, he was not assessed or treated by EMTs at all. Why? Again, it's inexcusable. We have to do better. We never hear about the good things, though, that we do every day. And that is frustrating. And sometimes it makes those bad stories that you hear, the bad incidents that you have just build up. But it really only takes one of these to make the rest of our field look bad. We really have to focus on our mental health. If they have gotten to the point where they're burned out, then we have to, as a group, say we have to do something about this, because they shouldn't be out there taking care of our loved ones. And that's the truth. This article, how best to deal with unwanted memories of tough calls, that was published in 2017. It's actually a pretty good one. It is a minority of people who will go on to develop longer lasting PTSD symptoms, and we need to remember that. She said it's normal for our minds to replay tough and traumatic events until they settle. It's normal to question our actions in challenging circumstances. The majority will adjust and stay well. It's called resiliency. It's a natural recovery in the month after the trauma. But it doesn't mean that paramedics and EMS in general, or first responders in general are safe from risk. And research that they've suggested or conducted shows that paramedics are at greater risk of developing PTSD and other forms of psychological distress compared to that general population. But the good news is there is a natural recovery with those symptoms, and especially in the month after the trauma. So maybe it's a good time for us to sit and think about these things, write up a good lesson plan, find some research, and really talk to your students thoroughly about this. Some of the final thoughts: figure out how you can improve your own nutrition, exercise, and sleep. Talk to your peers because they understand. Let your family know that you're working on some stress issues so they don't take things personally if you come home grumpy. Build a good support network. Talk to each other. And really work with your employer, or work with the employers that are on your advisory committees to really increase mental health care in the workplace. And, finally, just breathe. And that's the important thing. I was going to show you this video, but I did not hit the sound button, so it won't work. But there was last fall or early winter, a gentleman who was stopped by a county sheriff's deputy for speeding. And the gentleman just seemed distraught, sitting in his car. And after the deputy calmly talked to the gentleman for a while, he finally said, "What can I do for you today?" And the gentleman who was pulled over said, "I could really use a hug." So he literally stood there in the roadway, gave the gentleman the hug that he needed, and everybody moved on with their day. Sometimes that's all somebody needs, is just a hug, or just to be listened to, whatever that is. We can do that. So how can you help in the classroom? Bring in a mental health expert, somebody who knows about first response. Spend time with your students in that mental well-being. Practice what you preach. Learn more about mindfulness and practice it in the classroom. Remind students that their mental health is as important as their physical health, and that there is no stigma with taking care of your mind. That is all I have. I'm going to go through some of the Q&A or the chat and see if anyone has a question.
Sure.
Charles wrote that these events have fostered a culture of increased violence toward EMS. I would agree. I just hope that the more we learn, the better we can handle those situations. Maybe even getting someone an expert on de-escalation techniques. And I think that's important for all of us. We are still trying to find a good subject matter expert for that topic. So if you know of anybody, let me know. And I don't see any other questions. Is there anything in the Q&A? I can't see my tool there. No open questions. Well, I appreciate everyone listening to me today. I hope that this helped a little bit. I hope that you can maybe improve your mental health stress management lectures. If there's anything that I can do, please reach out to me and I would be glad to help.
All right. Thank you so much, Terrie, for being here with us today and presenting on such an important topic. Everybody, I will make sure that in tomorrow's follow-up email, you will get Terrie's contact information as well as a link to a recording of this webinar. And I believe that's everything. So thank you again, Terrie, and have a
Thank
great day,
you.
everyone, okay? All right, goodbye.
Bye.